Could also be, I don't know where the line is or which direction is going in, but when you're healing from lipo, all kind of stuff can cause lines, which is why you have to be really careful about the undergarments, where you're under. Like, I have my patients wear their underwear. Like, if they want to wear panties, then they need to put them on top of the garment, because if you put panties underneath the garment, then the garment's going to smash the line of your panties into your skin, and you'll heal that way. So then you'll have a line across from your underwear being pressed into your skin by your compression garment and stuff like that. It's like different. It's like lots of different things that you have to take into consideration during the healing process with liposuction to keep stuff like that from happening. If it's black, depending, it could be the friction from your underwear that made it turn black, or it could be a burn. Sorry about that. I can't say if it's a burn or not without seeing it. Visible veins on the face, yes, there's things for that. And yes, there's things for rosacea. Yeah, I'm not sure what you mean by it's high up and now it's low. Like I said, it could be from your underwear being pressed into you, the way the garment folded your skin while you were healing. It could be a burn. I mean, there's lots of different things. I can't say without seeing it. And please, people, do not inbox me pictures asking me questions, because I'm not going to answer them without a consultation. So don't send me pictures and say, what do you think? Because I will not. I don't do consults through Facebook. Just so you guys know. Okay, let me go back and see what questions I missed earlier. Oh, it looks like I've been answering the questions pretty good. No cut lipo. So you have to make a cut in order to do liposuction. There's a lot of like lipo, when they're saying that, they mean maybe lipolysis. So non-surgical things that actually are not surgery, stuff that's being done to you from the surface to try to kill fat cells. But liposuction, there has to be a stab incision. They're really, really small, but you can't get the fat out without making a hole to suck it out. So sometimes people call it lipo when it's really just lipolysis through the skin with different types of technology, laser, fat freezing, whatever. But if it's truly liposuction, where fat is being sucked out, incision has to be made in order to put something in to suck it out. But the incisions are super, super tiny. All right, I think I got all the questions. Let me come down to the bottom. Lipo is permanent. I did a Facebook Live about that too. I will reshare that one and get it circulating again. It was called "If I Get Liposuction in One Area, Will the Fat Come Back Somewhere Else?" or something like that. I think I called it, and I go over all that. So I will reshare that video, or you can go through my my list of videos and look for that title, because I did a whole video just on that topic. It is permanent. You can compromise your result by gaining a bunch of weight, but it's permanent. My only worry is work. I'm lifting on patients at the hospital. If I get a tummy tuck, when can I go back to work? You need to discuss that with your surgeon. I tell people 10 to 14 days for the most part, unless you have like a super duper strenuous job. But most people can go back at 2 weeks, by 2 weeks. Consultations, we can get you in. I make time for consultations. So if you want a consultation, you can get a consultation. Inbox me your name. I see your name. Inbox me your phone number and your email address, and I will have somebody from my office contact you in the morning. My consultations are $150. They're not free. The consultation fee will come off the cost of your surgery if you decide to book surgery the day of your consultation, and it will take it off the cost of your surgery. So then it's like it's free, but it's $150 for a consultation. I do both virtual and in-person consultations. Obviously, I'm going to do in-person consultations, but I do both because I do have people from all over who want to consult. The process is a little bit different pre-operatively for people out of town, but we make sure everybody is evaluated prior to surgery to make sure they're safe for surgery. What do you mean lipo injections? Do you mean fat transfer or like Kybella? What do you mean lipo injections, Jillian? You can't remove skin without, well, what do you mean? Remove skin from your abdomen? You can tighten skin from your abdomen, which is not removing it, but you can't remove skin without cutting it off. Loose skin above the belly button, depending on how much it is, you may be able to do like some sort of non-invasive tightening stuff, but it just depends on how much you have. The cost, Tabby, or you want to lose belly fat. Like, I can't tell you the cost without seeing what you got going on. It's more than one way to remove that stuff, so got to see what we're dealing with to give you a price. LED light fat reduction, I can tell you that is nothing compared to lipo, and it probably doesn't really work. I wouldn't waste your money on that. If it costs $100 or $200 a treatment, don't waste your money. Yes, I can talk about brachioplasty one night. Gummy bear implants do not harden over time. If your implants start to get hard over time, that can happen with any type of implant, and that's called capsular contracture. And that actually doesn't have anything to do with the actual implant itself. It's an inflammatory reaction your body does. Sometimes people just have bad luck and that happens. Lipo starts at $4,000 in my office. Lori, like I said, I have to see the belly button before I could tell you how I would fix it if it's a revision. But usually something has to be. Well, no, yeah, I have to see it. I'll have to see it. Air sculpting. I don't know what air sculpting is. That's a new one to me. I need to look that one up. I've never heard of air sculpting. I've heard of CoolSculpting, Liposculpting, but I'm not familiar with air sculpting. I do scar revisions. It sounds like what you have going on, though, would require more than a scar revision to make it go away. By physical exam, Angela. So she says, how do you determine if somebody needs a neck lift or lipo? Examination, I would be examining the skin and where the fat is. Okay, so you can have fat above it's called the platysma muscle, the muscle in your neck. If the fat is on top of that muscle, liposuction works. If it's underneath it, you have to get a neck lift. CoolSculpting is in fact effective. No, tickle me liposuction is not the same as regular liposuction. Yes, you can get liposuction if you've had a previous abdominal surgeries. This is a situation where a physical exam prior to surgery is paramount. If you've had surgeries before, then you have a higher risk of what's called like ventral hernias or incisional hernias. And if you have something like that going on, you don't want to be getting liposuction. So you need somebody to thoroughly examine you to make sure you don't have some sort of a hernia that we don't know about. Because if you do and you get liposuction, that causes really bad complications that could really, really hurt you. CoolSculpting, I guess it's not less invasive. So I guess technically it would be safer than liposuction. But it's not more effective than liposuction. So you just want to make sure if you're getting liposuction, that the person actually is qualified to do it. And CoolSculpting, a lot of people do CoolSculpting, and they'll do CoolSculpting when you are not a good candidate for it because that may be all they have if they're not a surgeon. And I've seen that a lot. People like, I got CoolSculpting and I spent it, and I'm looking at them like, whoever had you pay for CoolSculpting should be shot, because there was no way you were ever going to get to a good place from where you're starting. But if that's all they have to offer and you come in asking for it, they're going to give it to you. So I am a plastic surgeon, so I'm not really, that's like a gynecology question. Y'all be asking all kind of stuff. I'm a plastic surgeon. I am not going to be talking about yeast infections on my Facebook Lives. Leslie, thank you for joining me, honey, but that's not, come on now, honey, I'm a plastic surgeon. Fat embolism or DVT or like pulmonary embolism. Fat embolisms, with liposuction, technically you could get one, but that is more when you transfer the fat back into you that you get fat embolisms. And with liposuction, pulmonary embolism is, you know, kind of a similar risk to other surgeries. Tickle Me Lipo is not something that I endorse at all, so don't keep asking me about it because you're not going to get the answer you want. Get some real liposuction. All these gimmicky things, like, you're not about to get an endorsement of Tickle Me Lipo out of me. If you want liposuction, get real liposuction from a surgeon, a plastic surgeon. It depends on the person, sweetest pie go tell. Sometimes with people, I'll do the tummy tuck first. Sometimes I do the liposuction first. It just depends on what the person has going on. Either way is not wrong. Liposuction, that's a good question, Bukikia. I tell people if they're interested in a tummy tuck and they're going to have a kid soon, to wait. But liposuction, not necessarily. Like, I would get liposuction